Usually when I give my healthcare talks, I'm talking to a lot of people my age and older. This is such a privilege to see so many young people here. So I hope that this message will be so important to you, because as I listened to Jay's talk, it struck me how many people in this room may not have even been born at the time that the Berlin Wall came down. So you're not even that familiar with the whole communist, the Cold War, and the fights that went on for decades. I'm here to talk about the morality of decision-making in healthcare. No discussion could progress without this question: the right to health care. It's always hard to know how to answer that question. I think the best answer is, what do you mean by the right to health care? Do you mean the right to pursue health care? We all have that. We can all seek out health care. Do we have the right to access to health care services? Most places, yes. Some people have more access to specialty than others. Or are we talking about the right to equality in healthcare? When, over the years, you've heard a study quoted, a 2002 WHO study on world healthcare, where the United States ranked 37th. Wow, what a travesty. We must change our healthcare system. The government must now take control of our healthcare system, because we're number 37 in the world. Understand that that study and that ranking was organized by countries with socialized medicine. I'm happy to score poorly under those circumstances. They ranked countries according to how equal healthcare was across the entire population. In other words, if everybody had access to fairly poor quality healthcare, it was better than if everyone had access to poor quality care, but a great number of people had access to varying levels of even better care. Okay? So understand that equality in healthcare is typically, well, by definition, must go down in order to achieve its goal of equality. Now, if that's not what you mean, do you mean that somebody has a right to free healthcare? Because if that's what you're saying, then you're telling everyone in this room that it's okay for me to walk up and take money out of your pocket because I want or think I need something. Okay? It's also saying that as a physician, you believe that you have a right to my skills and knowledge. So when someone says everyone has a right to health care, the immediate response you should give is, what do you mean by that exactly? Let's talk about the philosophy of healthcare. This will help you to understand what's happening with, we'll call it Obamacare, PPACA, I won't even call it the Unaffordable Care Act. I refuse to utter those words. Okay, so there was Hippocrates and Plato. Both guys wearing togas. Hippocrates, when I graduated from medical school, we took the Hippocratic Oath, and I think everybody, doctors still do, but the Hippocratic Oath is changing. The Hippocratic Oath that I took was based on Hippocrates, who believed that life was sacred, all life was sacred, from conception through infirmity and death. And that as a physician, we were bound to care for the individual as a patient, and to do what was best for the individual. Plato, on the other hand, believed that we needed to look at this as a society working with and having to deal with limited resources. So in order to best allocate those limited resources, we needed to choose who was worthy of them and who wasn't. The very young could be expendable because we hadn't really invested our time and effort and other resources in their lives yet, so that they could be maximal contributors to society. The very old had already had their lifetime. They'd already spent their time, had their fun, contributed what they could. Now they were no longer contributing, they're expendable. Anyone who was developmentally delayed, crippled, not only did they not get resources, in some cases they should be put to death. That's a very big difference between these two philosophies. Here's a quote: "Unlike allocation of healthcare resources by sex or race, allocation by age is not discrimination. Treating 65-year-olds differently because the stereotypes would be ageist, treating them differently because they have had more life years is not." Ezekiel Emanuel is a physician, brother to Rahm Emanuel, President Obama's prior chief of staff, and Ezekiel Emanuel is a primary health care policy advisor to President Obama and among the authors of the Unaffordable Care Act. Plato in action. These are all things that are in the health care law. Abortion, free, paid for by employers, paid for by insurance, covered by all insurance. Sterilization of any female as young as of her first menstruation, as of her ability to reproduce, which means as young as 12 years old. It's not mandatory sterilization, but it's free sterilization should they choose to have it. Assisted suicide is no longer a crime, and comparative effectiveness that puts a dollar value on our remaining years, expected remaining years of life to determine whether or not we get a medical treatment. So who gets to choose and who bears the consequences of those choices? I would put it to you that whoever pays gets to make the rules. If government pays, then they'll create a huge bureaucracy, which they have. They take money from workers, taxpayers. They control how much health care patients will receive, from whom, and when. They will control how much doctors, hospitals, and other providers will be paid. It's a lot of control. Unfortunately, in this country over the last 50 years, we have allowed government and industry to create a system whereby the person receiving the care and the person giving the care are bureaucratically separated from the person paying for the care. We have given the wrong people control. When government controls health care, it controls the people. When government controls health care, it controls the people. When an individual, on the other hand, is in charge, the patient will control how much health care they receive, from whom, and when. The patient and the doctor or provider decide or agree on a price for a service. They make the exchange, win-win situation. The patient pays the provider directly, and there are ways to do this. There are absolute ways to do this. Read my policy paper, where we talk about changing the system we have to a cash pay system. That doesn't mean that you have to pay these exorbitant amounts of money. What it means is that if you get the bureaucracy out of the way, actual healthcare costs could be decreased by 50 to 70% almost immediately. So the patient pays the provider directly, little or no bureaucracy. Understand that when government is in control, they don't care so much about the individual. They don't care about the individual patient. They care about the collective. They care about society, and they most certainly care about their own survival as a bureaucracy. Government bureaucracy exists for the perpetuation of itself, not for the perpetuation of the people. If an individual is in charge, then those individuals also have to accept responsibility to take care of the people who are truly needy. Truly needy. Not the people who choose to be needy, or the people who make very bad choices continually and are therefore rendered in need. It is our responsibility, I believe, as Christians and as human beings, to take care of the people who are truly unfortunate and truly needy. And if we are going to get rid of government and bureaucracy, we have to be willing to accept that responsibility, in my opinion. Booker T. Washington's autobiography, Up From Slavery, I thought is a fabulous book. If you haven't read it, I highly recommend it. It should be required reading, I think, for every school in the country. What he said was, or he told a story early on in the book, because he was a very small boy as a son of a slave woman. And when the emancipation came about and slaves were freed, there was great celebration. Until suddenly they stopped celebrating long enough and looked around and said, now what do we do? What does freedom really mean? How do we do freedom? I don't know how to go get a job. I don't own anything. I don't have a place to go. It's a very frightening time for them. Some of them were able to embrace it, and they could go out and make a life for themselves, and they understood what to do with their freedom. Other people were frightened. Without being told how to handle or how to control or what to do with their freedom, they ended up, many of them went back to their masters. That's where the saying comes in, those who would trade freedom for security deserve neither. So what I would put to you is, unless we are willing to take it upon ourselves to be responsible for ourselves, we are progressing down the road into slavery through relying on the government and asking the government to provide things for us that I believe we should provide for ourselves. Healthcare. So, personal responsibility or dependence on government is the question. Do you remember in the good old days when, I'll tell a story. We had some friends that were farmers in North Dakota, and their 14-year-old son was a bull rider, right? Rodeo bull rider, craziness. He got thrown and actually became a quadriplegic. So he needed a lot of care. And they were farmers in South Dakota. So the family was with the son here at Craig Hospital in Denver. And it was time for the harvest. The community of farmers in their town all took their combines and tractors and equipment, harvested that family's farm for them, crop, so they could be here with their son. The government didn't make them do that. They did it themselves, and the family was thankful, and they said, thank you. As a physician, one of the wonderful things that I get to experience is helping a patient through a very difficult time. I deal with breast cancer, so there's a lot of difficult times in my clinic. One of the most wonderful things is being able to help someone through a difficult time period and have them look you in the face and say thank you. When we give of ourselves, give of our money, give of our love, our charity, and someone says thank you, that's a symbiotic relationship. A symbiotic relationship between individuals or involved organizations. When government takes over for our charity, that goes away. Thank you becomes entitlement. Government wastes our money before it ever gets to anyone in need. They manipulate the system. They use it for their own personal gain and to increase their own power rather than to actually help the people. They use it to control the people. The people who receive that money, there's nobody to say thank you to, right? It's just come out of the air. It's come from government. That leads to entitlement. I deserve that money. You owe me that money. I said, what would happen if someone who is on welfare or someone who's getting a government check had to turn to a taxpayer, look them in the eye and say, thank you? So the question is, what are we prepared to do? It all sounds good, it all sounds easy, but it's not. We've all, over the last 100 years, gotten to rely on government to provide for a lot of our needs, haven't we? So, if we are going to break loose from this, and healthcare is the bottom line of all this, if we're going to break loose from this, we have to be willing to accept the consequences for our decisions, to accept responsibility to pay for ourselves, and I say, especially to pay for those people who really and honestly need it. That means churches, individual charities, and individuals. Used to be, gosh, when I grew up in northwest Iowa, and we had very small churches, and there were some needy families. At Christmas time and things that, if they needed something, they came to the church. The church came to us. We worked with that family to help them. Not much of that happens anymore. We're going to have to be ready and willing to accept responsibility for those in need rather than to rely on the government. It's much easier to just rely on the government. How many of us benefit from some legislator passing legislation that's going to help our industry? Gosh, everybody does that. Have you ever gone to a legislator or a city council person and said, we could really use a little bit of city council money to help with this organization. We want to be having meetings and so forth, and we need some administrative help and all that because we just can't get funding for it, or we don't want to have to go out and get our own funding for it. It's a big step. It's a big step to take responsibility for self, but I believe that that's what we need. So the question is, what are we willing to do? Self-governance is not a spectator sport. Everyone here cares enough to be here to do this. So now we have to ask ourselves, are we ready to take the next step? If we're ever going to be free in healthcare, if we're ever going to get rid of Obamacare, we have to have a system in place that we are prepared to support and interact with. So I would say to all of you, think about that and pass the word on to your friends and neighbors that these are the issues that we're dealing with. The underlying issues, Plato versus Hippocrates, the individual versus society, and individual responsibility versus dependence on government. Thank you.